Okay, it's Monday, August 11th. We're in South San Francisco today, the birthplace of biotech. I'm at a company, Maze Therapeutics. This is the CEO, Jason Coloma. And Maze is working on a really important disease that I don't think a lot of people know about. I didn't, and it's really important. It predominantly affects the African American community. It's APOL1 mediated kidney disease. What is that?
Yeah, no, so APOL1 kidney disease, Brad, disproportionately affects the Black community. At least 13% of all African Americans have the variants that eventually cause the nephrotoxicity in the kidney. And so about 1 million individuals have these variants just in the US alone. And unfortunately, there are no approved therapies for this form of genetically defined kidney disease. Now, at least 250,000 individuals in the US that have high levels of proteinuric disease could benefit from a therapy. But unfortunately, there are no approved therapies for these patients. And so if we have a better understanding who these patients are now. So aside from being disproportionately affecting the Black community, we know that they're younger. So they typically clinically present before the age of 50 versus I would say more classical chronic kidney disease patient, which is past the age of 50. We know that they have, if you will, accelerated progressive disease in the sense that they transition to dialysis at least 10 years earlier than those that don't have APOL1 kidney disease. And we know, unfortunately, that they are not responding to current standard of care, including SGLT2 inhibitors, RAS, or any of the ARBs that are currently being treated for these patients. So unfortunately, we know that they're younger. We know they have more accelerated form of disease, and they're not currently responding to standard of care. So if we at Maze Therapeutics can develop a therapy for the underlying cause of disease itself, which is the APOL1 gene, we believe that we can develop what could be the first disease-modifying therapy for these patients.
All right, so they have a small molecule for that. It's in the clinic, it's in phase 2. This sounds a lot like sickle cell disease. Maybe your work will raise awareness of it because it sounds really important. We had a full discussion about this program and others that Maze is working on, so check all of that out on BiotechTV.com.